from Mindful Midwifery. You can check us out at www.njmidwifery.com. Today we're going to talk about 4 postures that you should avoid in pregnancy. If you only take one thing away from this video today, it's that crossing your legs is the #1 posture to avoid in pregnancy. When you cross your legs, you usually favor one side over the other, either right or left. And that causes you to have a decreased amount of circulation in your leg and causes varicose veins, which we all hate. The other thing is that when you cross your legs, it lifts your pelvis up just slightly on one side, misaligning the pelvis and causing your hips to be out of line. When you're pregnant, you actually have hypermobility in your sacroiliac joints. And when you cross your legs excessively, that can create your pelvis to get out of shape and can cause problems for labor. The second position that's very important to avoid is the slouched position. So anytime you're sitting in a chair, you want to avoid this lounged, slouched position. Not only does this not engage your core, but it also can cause lower back pain and lumbar pain. And this position is how babies favor the sunny side up, or the occiput posterior position, when babies come face out. For labor, it's ideal if the baby's face is facing your spine in the anterior position. So if you need help, what you can do is you can get a small little tilt on your back. You can actually purchase a coccyx tilt pillow on Amazon and use it when you're riding in your car, sitting down at work, or you can just use a blanket. And what you do is you just put this right underneath your sits bone, and it actually tilts you forward just slightly, creating a better posture for pregnancy. The third position that you should avoid in pregnancy is tilting the head excessively. So a lot of times when we're on the phone, we like to cock our head to multitask. Believe me, I've been there. But this position can actually also cause misalignment in the spine, tightness in the shoulders, and upper back pain. So it's important to remember when you're on the phone, one hand at a time. The fourth posture that we're going to be talking about today is lifting. So we're all guilty of bending down and picking something up. But when you're pregnant, this can actually cause a lot of problem on your lower back, causing strain. So what you want to do is you want to bend down and then lift. Sometimes you can even do a 2-part lift where you rest something on your knee, collect your core strength, and then step up. So let's recap the 4 positions that we talked about today that we want to avoid in pregnancy. 1, crossing your legs. 2, talking on the phone. 3, the slumped recline position. And 4, bad lifting. Happy pregnancy!